Percutaneous posterior lumbar interbody fusion, percutaneous PePLIF. This novel concept to lumbar interbody fusion combines two emerging technologies in spinal surgery. 1. Ultrasonic bone and disc removal, and 2. Expandable interbody cages. In percutaneous PePLIF, the surgeon performs the entire operation percutaneously without the use of a microscope, endoscope, or magnifying loops. Indirect visualization is obtained with a wide range of navigation options, such as C-arm fluoroscopy or more advanced CT, MRI-based systems. This is how it works. Through two paraspinal incisions, right and left, the surgeon places percutaneous pedicle screws in the inferior pedicles of the interbody segment to be fused. Percutaneously, and by using the pedicle screw towers as a rail, the surgeon sequentially advances soft tissue dilators to the facet joints above the inferior pedicles. Then, the final soft tissue retractors are locked onto the pedicle screw towers and facet joints bilaterally. Ultrasonic bone removal and aspiration of an 8 to 12 mm cylindrical pathway in the facet joint occurs into the lower foramen to the recognized percutaneous PePLIF work-safe area and lateral disc space. Alternatively, a perforator drill bit can be used to create the cylindrical pathway. Once in the foramen, K-wires are placed in the disc space, and sequential disc dilators are docked onto the posterior disc, safely displacing and protecting the exiting nerve root and dural elements. Then, the final disc retractors are angled a few degrees inwards and locked onto the soft tissue retractors. Ultrasonic disc removal and manual disc and cartilaginous end plate removal of the lateral disc is achieved. Expansion and sizing of the disc space is obtained. The expandable interbody cages are introduced, expanded, and filled with bone graft. Both cages, right and left, are located laterally against the stronger apophyseal rim of the vertebral end plates. Posterior instrumentation is finalized as the last step. All of this is performed percutaneously without opening, exposing, or retracting the dural and nerve elements. This is a major paradigm shift from conventional open and minimally open approaches to lumbar interbody fusion, such as ALIF, DLIF, PePLIF, TLIF. Percutaneous PePLIF offers major advantages including reduced surgical time, single prone patient positioning, reduced tissue manipulation and/or disruption, solid bilateral interbody support, anatomical reconstitution and fusion, avoidance of abdominal, lateral, and oblique accesses and their related side effects and morbidity, easy to use by most surgeons familiar with percutaneous placement of posterior spinal instrumentation, cost-effective approach utilizing readily available navigation systems, C-arm, CT, MRI guided, equipment, and instrumentation, all of which would translate in less blood loss, less post-operative pain, shorter hospital stay, shorter recovery, overall improvement in cost, widespread use in inpatient and outpatient settings.